Hi, welcome to HealthTime03. Today we are going to talk about vomiting. Vomiting isn't a disease, but rather a symptom of many other different conditions. Vomiting can be caused by food poisoning or by infection from viruses and bacteria. Early pregnancy is also a common cause of vomiting. Sometimes, vomiting can be a symptom of a more serious condition, such as liver or kidney disorders. The biggest problem with vomiting is that it can lead to dehydration. Signs of mild to moderate dehydration include dry mouth and few or no tears when crying. A mildly dehydrated infant may have less than 4 wet diapers per day. A mildly dehydrated child may go up to 6 or 8 hours without urinating. With severe dehydration, the child's mouth will become so dry that it looks sticky inside. The child's skin will also be dry and wrinkled. The child will be more sleepy than usual and may appear weak or disoriented. He or she may also have a weakened pulse and will be breathing more deeply than usual. Treatment for vomiting usually involves a few things. First of all, drink clear fluids. Start with small amounts and increase your intake as you feel better. If you throw up what you have drunk, try starting with a little less, beginning with just a few sips. Avoid any solid food and discontinue oral medications until the vomiting has passed. And try to get some rest. If you feel nauseous, drink small amounts of sweet fluid, such as soft drinks or non-acidic fruit juice. Drinks containing sugar help to calm the stomach better than other drinks. Also, sleep in a sitting position or lying down but with your head propped up. Activity may make the feeling of nausea worse and may lead to vomiting. To prevent nausea, eat small meals throughout the day rather than 3 large meals. Eat slowly and avoid hard-to-digest foods. Try eating food at room temperature, as the smell of hot foods may make the feeling of nausea worse. Rest after you eat, but make sure that you keep your head elevated at least 12 inches above your feet. To treat motion sickness in a car, make sure your child is looking straight ahead at the front windshield, as the movement outside of the car windows can make the feeling of nausea worse. Don't let your children eat and play at the same time, and don't let them eat while the car is moving. Vomiting usually subsides within 6 to 24 hours and can often be treated at home. Do call your doctor, however, if your home treatment is not working, if dehydration is present, or if a known injury such as a head injury or an infection is causing the vomiting. If you have a child who has been vomiting for more than a few hours, call a doctor. Also call a doctor if the vomiting is accompanied by diarrhea, fever, or any of the symptoms of dehydration that I mentioned, such as infrequent urinating. Okay. Here's a recap of some of the things I spoke about today. Vomiting is not a disease, but rather a symptom of many different conditions. Vomiting can be caused by food poisoning or by infection from viruses and bacteria. Pregnancy can also cause vomiting. In some cases, vomiting can be a symptom of a more serious disease, such as kidney or liver disorders. The biggest problem with vomiting is that it can lead to dehydration. To prevent nausea, eat small meals throughout the day rather than 3 large meals. You should see a doctor if home treatment is not working, if dehydration is present, or if a known injury is causing the vomiting. If you have a child under 6 years old who has been vomiting for more than a few hours, call a doctor. Well, that's it for today. I'll see you again soon.